This is a brief video guide to help those working in adult social care better understand and support people with learning disabilities and autism. To begin with, here are 3 things we'd like you to know.
Many of us have existing trauma which can affect actually how we respond to certain situations.
Some of us may have received a late diagnosis which may have affected our life experience.
People with learning disabilities often face worse care outcomes which could affect our trust in the care we receive.
But we have lots of tips for how you can help. When communicating, keep in mind
Everyone is unique, so take the time to consider everyone's individual needs. Do not be afraid to ask what our needs are.
How we process information can vary, so explain things in a way that we'll understand. Use simple language and be clear and concise. Avoid jargon. Some of us may benefit from visual aids like images or emojis, or from having a friend or family member present during discussions.
It's more productive to emphasise what we can do well rather than we can't. So focus on our strengths to help us shine.
And when it comes to our health and care,
To design more effective services, collaborate with people with learning disabilities in the planning process, particularly with those who have relevant lived experiences.
Navigating services can be complicated and stressful, especially if there's poor communication between departments. Assign a single point of contact, like a learning disability liaison nurse, to help.
Before any appointments, make sure we meet with the liaison contact, either virtually or in person, to discuss the process and manage expectations from the start.
Keep us involved in every decision which affects our care and communicate in a way best suited to the individual. This approach ensures that we are part of the process and we feel safe.
Our hospital passports contain essential information which can often be overlooked. Please read them and remind us to bring them to all our appointments, as it saves us from repeating the same details every time we go.
Where we're comfortable, involve our family members in discussions. They may provide valuable insight and a fuller picture of our needs.
Finally, for our support workers especially, please don't forget to look after your own health and well-being too.
by implementing these steps, we can all work together to make services fairer for adults with learning disabilities and autism.